Contraception is one of the most important topics in reproductive health worldwide. According to epidemiological studies in the United States, nearly 45% of pregnancies are unintended, and a significant portion of these pregnancies end in abortion. Understanding contraceptive methods and choosing the right one plays a major role in both personal and family health. Contraception becomes especially important for people who are taking teratogenic medications, meaning drugs that may cause birth defects, or for those with underlying medical conditions where pregnancy could be high risk. Hormonal contraception is generally divided into two main categories. 1. Combination hormonal contraceptives. These methods contain both estrogen and progestin. 2. Progestin-only contraceptives. These methods contain only progestin. How do they work? Estrogen mainly prevents follicle development by suppressing FSH. Progestin works by suppressing the LH surge, which prevents ovulation. Progestins are used in different forms, including combined oral contraceptive pills, progestin-only pills, skin patches, vaginal rings, depot injections, subcutaneous injections, implants, some hormonal IUDs such as levonorgestrel-containing IUD. It is important to note that copper IUDs are not hormonal contraceptives. In addition to suppressing ovulation, progestin-based contraceptives also work by thickening cervical mucus, making it more difficult for sperm to pass through. They also create changes in the uterus and fallopian tubes, further reducing the chance of fertilization. Now let's talk about drug interactions. A common concern is whether antibiotics reduce the effectiveness of birth control pills. Contrary to older beliefs and earlier studies, newer evidence suggests that most antibiotics, including amoxicillin, ciprofloxacin, and doxycycline, do not significantly reduce the effectiveness of birth control pills. However, some medications can reduce contraceptive effectiveness. These include rifampin, rifabutin, and some anti-seizure medications such as carbamazepine, phenytoin, phenobarbital. In these situations, additional contraceptive protection is recommended. Birth control pills offer benefits beyond pregnancy prevention. Some contraceptive pills have anti-androgen effects, which means they can help improve acne, excessive hair growth, and symptoms related to premenstrual syndrome. They are also commonly used in patients with endometriosis to reduce pain and help control symptoms. Like all medications, birth control pills can have side effects. Common side effects include nausea, breast tenderness or breast pain, spotting or irregular bleeding, headaches, bloating, or a feeling of abdominal fullness. These side effects are usually mild and often improve over time. However, there are also more serious complications that are less common but clinically important. These include deep vein thrombosis, also known as DVT, pulmonary embolism, also known as PE, stroke, heart attack. These complications are more likely in high-risk individuals, especially smokers over age 35, people with a history of blood clots, individuals with cardiovascular disease, people with migraine with aura. That is why a proper medical evaluation before starting combined hormonal contraceptives is essential. In some individuals, combined hormonal contraceptives are contraindicated and should not be used. These include women older than 35 who smoke, people with a history of thrombosis, coronary artery disease, prior stroke, heart failure, migraine with aura. Now an important question. When should birth control pills be stopped immediately? And when is urgent medical evaluation needed? To remember the warning signs, we use the well-known mnemonic ACHES. A stands for abdominal pain, severe abdominal pain, especially pain in the liver area. C stands for chest pain, severe chest pain, shortness of breath, or coughing up blood. H stands for headache, a sudden, severe headache. E stands for eye problems, blurred vision, double vision, or vision loss. S stands for severe leg pain, severe pain in the calf, or significant tenderness in the leg. If any of these symptoms occur, birth control pills should be stopped immediately, and urgent medical attention is necessary. There are also symptoms that should be medically evaluated, but are not always emergencies. These include complete absence of menstrual periods, especially if pregnancy is possible, a breast mass or breast lump, pain in the right upper abdomen, milk discharge from the breast, Now let's talk about a very common question. What should you do if you forget to take your combined hormonal birth control pill? This is one of the most common concerns among birth control users. The approach depends on how many pills were missed and how much time has passed. If only one pill is missed, or if less than 48 hours have passed since the missed pill, take the missed pill as soon as you remember. Then continue taking the rest of the pills as usual. For example, you forgot last night's pill. Today you remember. Take the missed pill right away. Then continue with your scheduled pill later that same day. This means you may take 2 pills in one day. That is completely acceptable. In this situation, no backup contraception such as condoms is usually needed. Emergency contraception is usually not necessary. However, there are special situations where emergency contraception should be considered. This is especially important if missed pills happened early in the cycle. For example, if the missed pills occurred during the first week of the pack and you had unprotected sex within the last 5 days, then emergency contraception should be considered. For example, you are in the first week of your pill pack. You missed 2 pills in a row. Yesterday you had unprotected sex. In this case, emergency contraception becomes important. If 2 or more pills are missed, or 48 hours or more have passed, the recommendation changes. Take the most recently missed pill as soon as possible. Even if multiple pills were missed, only take the latest missed pill. Discard the other missed pills. Then continue taking the rest of the pack as scheduled. For example, you missed pills on Saturday, Sunday, and Monday. On Tuesday, you remember. What should you do? Take only Monday's missed pill. Do not take Saturday or Sunday's pills. Discard them. Then continue the rest of your pills as usual. This means you may still take 1 missed pill and 1 scheduled pill on the same day. That is fine. In this situation, backup contraception should be used for the next 7 days. Now let's talk about a special situation. What if missed pills happen during the 3rd week? This usually means around days 15 to 21 in a 28-day pill pack. Here, the rule is different. You should avoid having a hormone-free interval. That means, do not take the placebo pills. Instead, finish the active pills in your current pack. Then immediately start a new pack the next day. No break, no placebo week. For example, if you miss 2 pills during week 3, finish the remaining active pills. Skip the placebo pills. Start the next pack immediately. Why? Because the goal is to prevent hormone levels from dropping. A hormone drop increases the risk of ovulation, and ovulation increases the risk of pregnancy. Finally, if unprotected intercourse happens after missed pills, emergency contraception may be needed. This depends on how many pills were missed, which week of the cycle you are in, and when unprotected intercourse occurred. That's why understanding missed pill management is so important. I'll also include the CDC guidance on missed birth control pills in the caption for those who want to read more. Thanks for watching.